Okay. Yes. All right. My name is Dede Wilson. I live in Hammersmith, and I live in Fulham. I live in Fulham near Charing Cross Hospital. I'm one of the early founders of Save Our Hospitals in our area. Was involved in it very much from the very, very beginning when the consultation was first brought out. My interest in it has been that I have been a patient there for over 40 years myself. Both of my children were born in Charing Cross, one of them born in the original Charing Cross, so I've seen changes in the hospital that have occurred both from the original and to the move to Fulham. I'm involved in education and have been involved in education and training for most of my life. And I'm mentioning this because this is a very, very important factor in terms of my interest as well, because Charing Cross is a teaching hospital. And it's a very, very key, very important teaching hospital, one of the top 10 in the world, registered as one of the top 10 in the world. So for me, that is a very key issue, and I also know people who are working there. So I feel very, very strongly about it from that perspective as well. And in the building itself, in the sense that it is a building that is very user-friendly, both for patients and for doctors, for people working there, and for students and medical students, and all of the facilities and everything that are there. So it's quite comprehensive as to why I'm involved. Thank you.
Can I just ask you to pause there to explain
Yes.
that you were, in fact, going to give evidence originally at the hearing in Hammersmith and Fulham Town Hall?
Yes. I was going to give evidence in March. It was March, wasn't it? Yes.
But so it's fair to say that you find yourself, rather than the beginning of the end of the process, taking the graveyard slot?
Yes, I'm taking the graveyard slot because, in fact, what happened was that, unfortunately, my mother had an accident. She spent a month in hospital in Canada, where she lives, and I had to go there to become a carer. And I was her carer. I've been her carer for almost 7 weeks there after she came out of hospital. So I have experienced firsthand, kind of in many, many ways, changes that have already occurred there that haven't occurred here yet because of trade agreements between the US and Canada.
What I wanted to ask you about, first of all, was a little bit about the consultation process, because you've dealt with that in some detail.
Yes.
Can you give the Commission your overall succinct views about whether it was fair and appropriate and did what it was supposed to do?
Right. Wow. That's a wonderful question. In a word, no, it was not fair. It did not meet many of Andrew Langsley's criteria to start with. There were things to do with, for example, the timing and when it was introduced. When it was introduced, it came out. In July, we heard about it in Fulham, but in fact, they knew about it in Chelsea in June. And they knew about it in Chelsea in June because it was introduced at Chelsea Westminster Hospital in their trust news, in their broadsheet in the hospital itself. So they had pre-advanced information about what was going on. The consultation itself was only online. It was not possible for people to do it until they were able to get a hard copy. Hard copy was not available unless you went online to get hard copy, or you went to a meeting where it was presented and you could get hard copy. This didn't actually happen for people until September, unless you lived in Chelsea, where they were delivered to people's doors. In Chelsea as well, in September, when we came back, we set up Save Our Hospitals in July when it was first introduced, the consultation. The consultation was brought out just before the school holidays, just before the Olympics, just before a time when people were not going to be around or to be able to be consulted at all. So it meant that people didn't know about it till they came back for the school holidays. Nothing was advertised. There was no leafleting in Hammersmith and Fulham whatsoever. The only way that people knew about it was through newspaper reports and advertising in the Fulham Chronicle. Otherwise, it was not available, unless you went online to Hammersmith and Fulham Council to find out that there was something there, that there were going to be meetings. The first meeting and public meeting was not held until September, not until the September of that time.
But how does that sit with, we heard evidence from various health professionals, including Dr. Spencer, saying that there was extensive consultation, that they had done everything they could, that they had put out numerous documents in numerous community languages. Didn't they do everything they could be reasonably expected?
Not at all, because in fact, as I said, in Chelsea those things were available. In Fulham they weren't. In Fulham there and Hammersmith there was a complete blackout in most of the hospitals and things, and I think it was the same thing in Ealing and all of the hospitals where they were not the favoured hospitals, if you like, not option A. If you wanted to find out, the only way you could find out was, as I just said, that was the only way that you could actually find those things out. I don't have a huge amount of faith in Dr. Spencer, because the very first time I spoke to him and told him what my interest was and that my children were born at Charing Cross Hospital, he told me that wasn't possible. And I said, "What do you mean that wasn't possible?" He told me that wasn't possible because they didn't have a maternity department. And I said, well, my first daughter was born at Charing Cross on the Strand. And he said, well, I was working there. I was doing my training at that time. And I said, oh, well, then you must have known Dr. Hugh Jolly, who was head of gynecology and obstetrics at the time, and a well-known authority on pediatrics. Oh, yes, I did know Dr. Jolly during my training. So I'm afraid I don't have a huge amount of confidence in Dr. Spencer.
Can I make a suggestion?
Yes.
Rather than asking an open and rhetorical question, you might want to ask a question.
Yeah. Sorry.
I did want to ask you about the closure of Hammersmith Hospital, of the A&E at that hospital.
Right.
Do you have a particular view about that? Were you able to provide information on that? Or is that outside of your remit, and would you prefer to focus more on Charing Cross?
I would perhaps prefer to focus more on Charing Cross, but I have been up to Hammersmith, and I have been outside as part of the campaign at Hammersmith. I went into the A&E department, and I also did know that in both of these places, things like the consultation documents were not available. And also many people who were working within the hospitals did not really know what was going on or what was happening to their hospitals.
If we move on to Charing Cross.
Yes.
Looking at the site in Charing Cross, do you know what the plans are for the site in terms of sell-off, if anything?
Specifically, because I've been away since a lot of the more recent things have come out, I only know that the plans, Imperial College plans at the moment, are really to demolish the main site. And as far as I know, it is to demolish the main site. And to rebuild, and this has been part of their plan, what they call a health and social care hospital, which will be much, much smaller. It's outpatients only, and basically is to provide urgent care, and walk-in is going to be quite limited, but I can't say because I have been away.
We know that the new urgent care centre at Charing Cross is designated as an accident and emergency unit.
Yes.
Do you know what that is going to consist of?
I don't know exactly, but the only thing I can say is that I have had experience since things have happened in the accident and emergency on 2 separate occasions. Once when I was severely concussed and was taken into hospital, and because I was severely concussed, I had no idea where I was. I was taken in and not in an ambulance, and ended up having to go through the triage. If it hadn't been after 3 hours for the person who was with me, who went and said, "What's happening here?" I wouldn't have been treated. I should have been my neck put in a brace and things like that, and that didn't actually happen. And eventually I did see and was taken into the hospital, into emergency. The second time was when I went in through my GP for septicemia, and I was taken in and didn't have to go through the triage and went in, but had to wait for a very, very long time before I was admitted to hospital and put on a drip. And I was on a drip for a day, well, 3 days actually, before something was actually done, because new people kept coming in, and if you don't get treated on the night of treatment, you have to, the next day, other people have taken your place.
Will the closure of the A&E as it stands at CCH cause risks to patients in that area?
I think it will cause severe risk, yes.
What do you say is the appropriate service that should be at that hospital?
I think we need blue light A&E, and that is what we need more than anything.
Now, I just want to turn briefly to out-of-hospital services. In terms of Hammersmith and Fulham's out-of-hospital services, do you have a view about whether they are advanced enough in terms of where they've got to have reduced acute beds or not?
No, I don't think so. Not at all.
Do you have a view, are you able to help us with whether or not you think that even if those out-of-hospital services are put in place, that will have the stated effect of reducing the need for acute beds?
No, I don't think so, because I don't think that the services or the standard of the services is appropriate enough to be able to meet the needs of people out of hospital yet, to keep them out of hospital.
I've actually reached the end of the questions that I needed to put to you. I'm just being asked if we could have a 5-minute break. I wonder if that's possible. What's the last one? Oh, sorry, I beg your pardon. I'm entirely misunderstood. I'm being asked if after the Commission has finished we could have a short 5-minute recess before we close matters out. Thank you.
Well, that would make some sense, but there are matters that we need to discuss. I'm going to ask, do you have any questions? Yes.
It's great to hear.
Hello. Microphone.
The last witness. Is Vanity had mentioned Dr. Hugh Jolly.
Yes.
I worked for him.
Oh, did you?
Yes.
Wonderful.
He's a paediatrician, God bless him.
Yes.
He gave me occasionally a hard time, but go on.
Oh, he was wonderful. He was.
I still quote him actually. And also, I delivered babies at West London Hospital, which is actually part of.
My second daughter was born at West London.
I'm glad to ask you.
Dr. Pawson.
I hope I didn't deliver it. But you've touched on two sensitive issues for me, actually, in your evidence. It's, page 1552 and also 1553. Going backwards, you mentioned Dr. Spicer, when asked by Dr. White, GPs have not been balloted as they have been exhausted, replied that it was not necessary as the PCTs knew what doctors involved thought.
Yes.
Gosh.
Yes.
And then, and here I want to go gently because I had colleagues at Lily Road Surgery many years ago and remember it as a really quite excellent.
It was, and yes.
So I wouldn't want to in any way criticise.
No, and I don't want to criticise them.
Why was it they were reluctant to allow you to leave leaflets about the process? Perhaps not even, you might say, okay, save our hospitals is a particular view, but you say you also wanted to leave consultation leaflets as well.
Yes.
Why do you think they declined to let you lead consultation? Because they should have had some in the surgery anyway.
Yes, they should have. They should have. And why they didn't, I don't know. And I couldn't actually get any answers to that. This was very early on in when we had, in the early days of having set up Saving Our Hospitals, and it was after the first public meeting that we had at Hammersmith Town Hall. And I went in to ask specifically if we could put up some Save Our Hospitals posters and have some information there so that patients could see what was happening and had access. Because one of the things that we had found, for example, when we were doing our campaigning outside the hospital, was that there are many people who were signing petitions, for example, didn't have access to computers. They didn't have access to computers. They had no way of finding anything out at all. So they were reliant on having hard copy. There was nothing in the hospitals, and you couldn't get hard copy in the borough anywhere. So I was quite surprised when, at the time, I didn't know that they were I've forgotten what you call the nurse practitioner. Nurse practitioner.
Practice manager.
Yeah. That she was the one who said, no, we can't do anything, that we can't take sides. So we can't actually put any information out because that would be taking sides with the hospital campaign. I found that completely baffling, and to the point where I didn't really know what to say to her. And because also at that time the consultation documents weren't available. The only places you could see the documents were at public meetings.
So they weren't available?
No.
And now I remember, I don't think they were available.
No, they weren't. No.
So I mean, I asked the question because I've been puzzled why there was such a limited response from GPs in respect of submissions.
I went round to a lot of the GP surgeries and I talked to people, and for the most part they were very, I'm very open and quite easy to talk to, were reluctant to talk, very reluctant to talk.
Have any of your colleagues, for example, been approached in a confidential way by GPs?
No. Many of... my feeling, and it's just a sense here, that the GPs themselves felt quite intimidated. That was my feeling about it, that they didn't want to put their heads above the parapet. And very few did. Very, very few did. And certainly within the hospital, and I know people working within the hospital, and having spoken to people within the hospital, nobody would speak out, because they were too worried about speaking out or saying anything.
Yes, that's a point I was interested to draw out. Thank you very much.
I don't have any questions either.
Okay.
One I was going to ask has been stolen from me. But thank you very, very much for attending.
Yes.
It's been useful for you as and everyone else.
Yeah.
That we hear you speak to us in person, as it were. What I think I'd like to do is, I think I need to discuss with the commissioners what will happen next. And so I'm going to have a 5-minute break, and then we'll come back and really want to update people as to the likely timetable of publication, bearing in mind some uncertainties at the minute. So if you wouldn't mind, we'll come back at 20 past. We should still be in time to leave before the 5:30 predicted.
Can I possibly mention just one more thing?
Of course you can.
And that is that one of my major concerns in this was the open electioneering that was allowed, and it was open electioneering in all of the favoured hospitals. And this was most evident in Chelsea Westminster. And in Chelsea Westminster, when I went in, it was not just the Trust News magazines, newspapers that were there. In the Trust News newspapers that were there were actually instructions as to how to vote for Chelsea Westminster. And not only were there instructions of how to vote, and I went through the whole hospital into every single department. On every counter in every reception of the department, there were these purpley blue cards where people could tick a box and they could submit this. And at a meeting, I actually, yes, Colin has got a thing there on it. And when I challenged Dr. Tim Spicer about this at one of the public meetings, I said, are these going to be discounted? And he assured me that they were going to be discounted. But for me, this was, as there was a blackout everywhere else, this for me was nothing short of third world. He did say, well, they are a foundation trust, so they are allowed to do this kind of thing. That was the other thing he said. Thank you very much.
Could I add something to that?
Now,
Just
I
very
think we're going to
briefly,
have, I'm afraid,
because every one of those cards was counted as one vote. A petition, we collected 2,500 signatures in Harleston, that was one vote. Hundreds of thousands were collected in Hammersmith. Well, one petition counted the same as each Chelsea and Westminster card. That's consultation for you.
Nanny, really good. Thank you very much.